What we're going to do is have some speakers that speak about some of our programs and then have an opportunity for questions and answers later. We thank you for your service and for participating in this town hall here and on MS Teams. And if you're part of the audience, the MS Teams, please place your questions in the chat box and we'll be able to address them that way. There is one administrative note. This is a public forum, so please refrain from sharing any personal health information in your questions in the chat. We value your privacy and we really want to protect that. So I'm Kathleen O'Loughlin. I'm the Women Veteran Program Manager here at the Atlanta VA, and it is my pleasure to speak with you all today. We do have some illustrious leadership from the Atlanta VA here in the chapel to be able to join us this evening, and I wanted to see if there's any of our leaders, our fearless leaders, that would like to introduce themselves and say hi. Oh, here comes one now, Dr. Norvell. He is the Chief of Staff, and he is over our women's program.
Thank you so much, Ms. O'Loughlin. I'm Dr. Robert Norvell. I've been here since July of 2022, and this is one of the highlights. My first town hall was our Women's Veterans Town Hall. It is always very exciting and also inspirational for me, because it helps me to see the things that we can do to help our women veterans to achieve the care that they would like to achieve. It's not what's the matter with you, but what matters to you. And so I'm always proud when I come to see what Ms. O'Loughlin and Dr. Pittman have done to move the care that we give our female veterans forward at the Atlanta VA. Because as Atlanta goes, so does Vision 7, and so does the VA. So we have the largest female veteran population. And I also have one of our acting associate directors, as well as my deputy, acting deputy here with me. So would you all join me? And I'd like to give them the opportunity to speak.
Hi, I'm Danielle Terrell. I'm the Acting Associate Director. I'm covering for infrastructure and was just previously in outlying sites. But I'm the full-time manager of community care. And this is also my favorite event. I am here because this is my favorite event, and I am a female veteran, and I do get my care here. And so I am very engaged in everything that is happening in this program. So hopefully you have really great questions, and just happy to be here in support.
Wasn't expecting this. Hi, I'm Nicole McIntosh, and I am one of the acting deputy chiefs of staff. I'm very excited to be here and to hear what's important to the team and to see how we can help facilitate that.
I'm Dr. Isaac Diaguero. I'm the acting associate director for outlying sites. Sorry, I had to run up here because I wasn't quite sure what was being held. I was on virtually. But I'm really excited to see where we move with this facility involving our women's health. I know Dr. Norvell has been heading a lot of these projects. I've seen a few of them. Mobile mammography comes to mind. But we're looking at a lot of promising new projects I'm really excited to be a part of.
I wanted to share this important information. We had maternity care coordinators create this slide. It's pink if you get the hard copy, and we call it the pink card. And it is a one-stop shop for getting all of the contact information that you may need. The thing that I like the best is the QR code that brings you to the Women's SharePoint, and that's the National Clearinghouse for Information. It has all kinds of trainings, campaign information, health statistics, and it's a really robust resource for all things women's health information. So please know we also have, I always like to make a plug for My Healthy Vet. It's a really great way to use secure messaging to directly communicate with your providers, and it is, it's a lot better than getting caught up in the phone line issues that sometimes happen. So secure messaging through My Healthy Vet, we really promote that. So the women's program aims to provide all women veterans with both high-quality comprehensive care and gender-specific services, and that's in a safe environment. And this is something that we value and we owe to our women veterans. They deserve that, and we really aim to achieve it. So when we talk about the women's program, we're really talking about comprehensive care, and that is the primary care all veterans receive here at the Atlanta VA. But with the women's program, there's some gender-specific care as well. So we have trained our primary care providers to be designated women health providers. So when you go to your primary care appointments, they're able to do things such as provide birth control and health exams, screening exams like PAP exams to check for cervical cancer. They can send you for your breast health screening in the community, for mammography care. And we really want to highlight the importance of these potentially life-saving gender-specific screenings and encourage everybody to talk to their primary care providers so they make sure that they're up to date on the screening schedule for them. So as Dr. Norvell mentioned earlier, the Atlanta VA serves more women veterans than any VA in the nation, and we are one of the fastest growing. So we have over 27,000, and our women veterans have served in every branch. They come in every age, and so we really want to acknowledge their service and thank them for that and make sure that we're receiving them the way that they need to be seen and served. Next, the Women's Wellness Clinic. So we have many places where you can get your care. We have so many CBOCs, those are the clinical outpatient, community-based outpatient clinics. And we have one that is just for women veterans. It's a primary care clinic that is called the Women's Wellness Clinic. So it is a Model 3 clinic, and what we mean by that is this particular primary care clinic has a women's only entrance and waiting area. So for women and those who identify as female, this is a space for them where they feel like they can come to the VA and get their care and not be the minority. We heard them say they wanted a more comfortable environment, and so we did create this clinic. It is a primary care clinic like the other clinics, but some women choose to travel to this particular location just for that benefit of being women only. Okay, so what we're going to do, we have several speakers that have joined us, and I'm going to introduce them and let them speak briefly, and then we're going to open up for question and answers after everybody introduces themselves. So our first speaker is Alicia Davis, and she is with the Public Contact Outreach Specialist, Women Veteran Coordinator from Veteran Benefits Administration.
Greetings, everyone. As Kathleen has said, thank you, Kathleen. It's a pleasure to be over here working and collaborating, being a collaborative with the Atlanta VHA Hospital. So, like she said, my name is Alicia, last name is Davis, and I'm also the MST coordinator for those females who have had some military sexual trauma during their career. So basically, I'm gonna talk about a few things, and what all veterans is like really concerned about is their compensation benefits, the reason why they're being denied, the reason why the process takes so long, and thus forth. I definitely want to say I am a veteran also. I understand your pain because we also have the pain points when we also file in our claims to get service connected for our benefits. So it's like 8 steps that the claims process has to go through. And the first thing that happens once the veteran submits their claim, after we receive the claim, not all veterans' claims will be processed at the Atlanta VA Regional Office. We have what we call a national work queue. With that national work queue, it's actually telling us that every veteran, no matter what state they're in, any of the 50 regional offices are capable of handling those claims. However, we do have a certain regional office that handles MST claims. We have certain regional office that handle our Navy Blue Water claims, Camp Lejeune, you name it. Not every regional office is qualified to do that, so they have segregated those particular regional offices to handle those claims. So once the claim is received, no matter what type of claim it is, we always do an initial review. So with that initial review, we go through and we check to make sure that whatever you have on that claim, that you have been service connected for it. If you have not been service connected for it, that's when the denial comes in. Because at the regional office, we look at what happened when you was on active duty, what's going on now that you are off of active duty. So once we get the initial review, we start doing the evidence gathering. So we look, like I said, we'll look through your records to make sure that whatever you're claiming, that you get, if you're not service connected for it, can't pay you for it. Well, that is it. Any further questions or concerns, you can ask me. I will be here to the end of the show. Thank you all. See, Kathleen, I'm trying to get on.
I know she was getting very detailed, and we love that about her because she has all those answers and all that information in the top of her head. So if you have those specific questions, we definitely want you to be able to put them in the chat box so that we can go to our subject matter expert. Thank you so much. Our next speaker is it's an Atlanta VA employee, and she works with the PACT Act. Kamari Stanley is a licensed clinical social worker, and she knows all things about the PACT Act. There you go.
Hello, everyone. I'm Kamari Stanley. Like she said, I'm a social worker and one of the PACT Act navigators for the Atlanta VA healthcare system. So I'm just going to briefly share some information about the PACT Act for those of you who still maybe not too familiar with it. But the PACT Act, whenever we say PACT Act, we're referring to the Sergeant First Class Heath Robinson Promise to Address Comprehensive Toxics Act of 2022. Which is yes, of course.
That sounds easy.
And that was a law that was passed, of course, back in 2022, which aims to expand and extend eligibility for VA healthcare and benefits for those veterans who experienced military toxic exposures and developed exposure-related conditions. So aside from the benefits portion of the PACT Act, which it created more than 20 presumptive disability conditions that you're able to file for, and you do not have to prove that those illnesses are service-connected. But aside from those benefits, the PACT Act also mandates toxic exposure screening, which is provided for every single veteran enrolled in VA healthcare. It is not a comprehensive health screening, but it is a 5 to 10 minute questionnaire between a veteran and their healthcare provider where they're able to discuss their history with military toxic exposure. So that way we can make sure that we're documenting that in their VA medical chart and providing them with the best exposure-informed care that we possibly can. This screening is not related to the benefits process, so we get a lot of questions about if I'm not interested in benefits, should I still do the screening? The answer is yes, because despite what you want to do with your benefits, we want to make sure that your healthcare providers are always aware of your military toxic exposure history. So if you haven't received a screening, our number is going to be in the chat, and you can reach out to us, and we will get you screened. Another thing that my team does is a lot of community outreach. We like to spread the word about the PACT Act and get people connected with benefits. So here's just some of our upcoming things that we've got going on. I'm not going to read each one of these out for you, but we've got a bunch of stuff going on in the community where we're doing toxic exposure screening on site, as well as benefits filing on site. So it's kind of a one-stop shop to be able to drop in, get your questions answered, get your screening and your claim all in one day. And then that Monday, September 19th, we just received the time for that conference. It is 9 to 5. I know it says to be decided there, but yeah, this is what we've got coming up. If you've got something going on in the community where you would like our presence, please reach out to us at our email or our phone number, which again will be listed in the chat, and we would be happy to support in any way that we can.
Kamari, thank you so much. And for people thinking about going to those events, they're great because a lot of other VA services have information booths, giveaways, they have staff there to answer questions. And like Kamari pointed out, you can file in person right there. So it cuts out the middleman. We're coming out to the community to make it a little easier for you. And our next speakers are from a program near and dear to my heart. It's our maternity program, one of our really fast-growing programs here. I have two of our amazing staff, and they are Adrienne Crawford, NP, and Zakia Moore, a licensed clinical social worker, and they work in our postpartum program, and they're going to talk to you a little bit about our services.
All right, good afternoon, everyone. So nice to be here tonight. Again, my name is Zakia Moore. I'm a maternity care social worker, and I'm going to review our maternity care program. So in our maternity care program, we offer maternity care coordination services. We have 2 lovely maternity care coordinator nurses that help with enrolling our veteran moms that are pregnant and want to utilize their community care maternity benefits, which are good throughout their pregnancy for their prenatal care, delivery, their postpartum checkup appointment, and also cover baby for the first 7 days of life. And this is their contact information, Miss Kinsey and Miss Habersham. And Miss Crawford is going to get a bit into our postpartum maternity program, which we are very excited about.
I'm actually going to pass this off. I don't think I need that. Hello, good evening, good evening. I am the newest kid on the block in our maternity care coordination team. My role is with Zakia, again, in the postpartum navigation piece of it. We've expanded the services that our maternity care coordination program offer to extend through the first 12 months because we know this is a really critical period where care coordination needs to continue. We know that 50% of maternal mortality and morbidity occurs during this time. Not loud enough. Thank you. My role focuses primarily on continued care coordination for the veterans who've had high-risk pregnancy complications, any other gestational hypertensive, preeclamptic disorders. I'm focusing on family planning, lactation support, ensuring that our veterans have gotten back into their provider, their OB provider for that 6-week postpartum visit, and also making sure there's a seamless kind of re-engagement with their PAC provider here, because that's also critical to continuing care for our veterans. Ms. Zakia is going to speak about the fabulous things she does.
Thank you, Adrienne. So I also do quarterly check-ins with our postpartum moms, do depression screenings, making sure any moms that might be at a high risk of developing postpartum depression or anxiety are getting engaged with their mental health services. We've also got some new exciting programs through Whole Health as well, making sure our moms have access to other resources that they might be interested in, like mindfulness, yoga as well, to help kind of strengthen their social support network postpartum and during pregnancy, making sure moms are getting access to their local resources, whether that be WIC, insurance for baby, pediatrician, and of course, making sure they're getting access to any housing needs they might have and food access as well.
So one thing I wanted to point out, so we have had consistently maternity care services. We have 2 RNs that work with our pregnant population. We have, I think it was 240 pregnant and 260 postpartum, so over 500 women in our maternity care program right now. And we heard our pregnant women and our new moms say that they were needing extra support during that first year. And as Adrienne talked about, and she is a midwife and a lactation specialist as well, so we really wanted to serve those new moms who were very vulnerable. And those were some of the highlights that we got from our women veterans. You all let us know it was a concern, and we're happy that we were able to address it. So thank you all for everything. Was there anything else that you were going to say?
Yeah, our contact information. Nope, that's it. Just making
Okay.
sure our contact information is there and we answer the phone. We're accessible.
Yes.
So if there are questions, please.
Yes, so if you have any questions, please, if you forget their names, reach out to me, Kathleen O'Loughlin. I connect people to all of these wonderful speakers for anything that you need. So thank you.
Thank you.
Okay, so we're moving right along. We are next going to talk about reproductive health. And our first speaker will be Jana Payan. She's a physician assistant. And then our next speaker will be our chief of gynecology, Dr. Jenny Gecken.
That one. Thank you very much. I'm Jana Payan, as Kathleen graciously introduced me. I'm a PA in GYN service. I've been in reproductive health and gynecology for over 30 years. And so today I'm going to talk to you, we talked about maternity care. I'm going to talk to you about when you're not pregnant, if you don't want to be pregnant, if you want to be pregnant and are having trouble getting pregnant, and what those options are within the VHA. So as far as birth control, the VA offers almost every single type of birth control that is out there. In fact, not almost. They offer all different types of birth control, from condoms and and barrier methods to permanent sterilization and tubal ligation. In between, we have long-acting reversible contraception, like IUDs, with and without progesterone IUDs, birth control implants or Nexplanon that go in the arm, good for up to 5 years. We also offer emergency birth control, Plan B. So, and that is something that you can get from your primary care providers as well. And also birth control pills and the routine stuff that most people know about, Depo-Provera, birth control pills, and other things that you can get through your primary care provider and don't need to come to GYN, which is a surgical service. Next slide, please. If you do want to get pregnant and are having trouble building your family, the VA also offers infertility services. Everyone is eligible for infertility services, regardless of your gender identity, your sexual preference. Everyone is able to have infertility evaluation and basic infertility treatments. First, we have you come to GYN, assess what you might need, and then sometimes we can take care of your needs within the VA. Otherwise, we will send you out to the community for specialized care. For those that might need in vitro fertilization, we have the guidelines and directives have been changed to be more inclusive. We're very happy about that. For those that do need in vitro fertilization, you still do have to have a service connection that is causally related to your infertility diagnosis. But now it is open to those who may need donor gametes, which are eggs and sperm, or donor embryos, but that cost will be at the veteran's expense. But it used to be where you couldn't, if you needed any of those, you didn't qualify for any in vitro fertilization services. So that's brand new. It used to be you had to be married to someone of the opposite sex, of the opposite gender. Now, single veterans, unmarried veterans, and and again, still married veterans are able to take advantage of IVF coverage as long as the other criteria is met as well. However, for the partner to be covered, you do still have to be legally married. But that does not now have to be for women, does not have to be a male veteran or male partner that can produce his own sperm. So those are brand new things. Egg cryopreservation was extended to include 10 years coverage for any egg or sperm that needs to be cryopreserved in cases of a medical eligibility criteria. So in other words, someone who will be losing their ability to make their own gametes, eggs and sperm, they would qualify to be able to go and get those cryopreserved for future fertility. It does not automatically make you eligible for IVF coverage, however. That would be determined on a separate criteria. The other newer thing, although it's not so new anymore, September of 2022, the VA amended its directives and implemented medical benefits to cover reproductive health, pregnancy options counseling. And what that means if a veteran finds himself pregnant and in a situation where it might be harmful to their health, whether that be mental health or physical health, or the pregnancy is a result of a rape or incest, that the VA can help to cover those expenses and provide that life-saving care for our veterans. So that's and across the country, that's being ramped up everywhere. So it is nice that the VA realized that our pregnant veterans need to be looked at separately and make sure that we're taking the best care of our pregnant veterans. And I'm going to, the biggest thing is who to reach out to if you find yourself in a situation where you need some counseling or may need some care. And that's also if you are having trouble accessing contraception or you have found yourself, trying to get pregnant and you're unable to, reach out to Kathleen, the Women Veteran Program Manager, or even the maternity care coordinators or our postpartum representatives, patient advocate, and your PAC team. Everybody has been educated on the process, and they will get you in touch with whom can help you the best. And there's also the Women Veteran Call Center, and that's for any concerns that you might have as a woman veteran or those that identify as women. I'm going to hand it over to my colleague, Dr. Jennifer Getkin.
Thank you.
Yes. Hi, everybody. I'm Jenny Getkin, and I'm the Chief of Gynecology. We were previously a pretty small but mighty surgical section, but we're growing, trying to keep up with the demands that we have with all our women veterans. That it keeps on being a recurring theme that we're focused on. Gynecology is a consultative service, which means that you, as a woman veteran, have to decide with your primary care doc that you need specialty care. So this is something that a consult has to be placed by your primary care provider. And the things that we can address that maybe can't always be addressed so easily in the primary care setting are the above. So we see patients with acute and chronic pelvic pain, abnormal uterine bleeding, vaginal discharge, gynecological precancers and cancers, female sexual dysfunction, infertility, menopause and healthy aging, urinary incontinence, pelvic organ prolapse, and reproductive health care. And Jana did a very good job of going through all the details about that last one. We are a big group, and I apologize for not having everybody's names here, but the majority of us, the vast majority of us, including my colleagues Alfredo Nieves, a new hire, Dr. Kevin Smith, Dr. Khanna, who's an oncologist, and myself, and our two wonderful PAs, Leslie Thompson and Jana, who you will recognize, all are currently serving our veterans here at the Atlanta main campus. It's a tight place right now. We are trying to change that. We have a few other sites, and we're trying to distribute our providers. We have dear Dr. Denise Williams, who is solely practicing over in the Fort McPherson. We hope to have Dr. Smith go join her in the near future as soon as that's possible to be able to provide care for our veterans more south than west of town. We also have one of our multi-specialty clinics down in far south, about an hour and a half from here in Zebulon, Georgia, at the Pike County Clinic. And Dr. Karsten on the left, Tiffany Karsten, and Lynette Wilkins, a nurse practitioner, both work there. So we are expanding and hope to expand even further. So our expansion plans are to, as I already mentioned, increase providers at Fort McPherson. And at some point in time in the very near future, I hope that we will be expanding to our Cobb multi-specialty clinic in Marietta to serve the northern quarter, where there are a lot of unserved veterans up there. And this is my contact, and you can reach out to me at any time. Thank you much.
Thank you so much, Dr. Getkin. We appreciate that. And we have another speaker from the Women's Program. This is our Women's Health Medical Director, Dr. Jamia Pittman, and she's going to talk about mammography.
Okay, good afternoon, everyone. My name is Dr. Jamia Pittman, as has been mentioned. I am the Women's Health Medical Director, and we are so delighted that you're with us this evening. And I wanted to talk a little bit about mammography care. Thus far, we've talked about comprehensive women's health care provided by our PAC services. We've talked about our comprehensive GYN care. We've talked about our maternity care programs. So hopefully, and our PACT Act. So hopefully, you guys are getting a sense as to how much we care about the women veterans and how many programs we have invested in and made sure that we provide for you all to carry on the care. And the next component is mammography care. We do follow the American Cancer Society guidelines for breast cancer screening for the average risk patient. Screening may start at the age of 40. And currently, all of that screening and the diagnostic workup occurs in the community in partnership with our VA Community Care Department. And the PACT, your primary care provider, as a part of your PACT team, places the consult, And then that consult goes on to community care, and community care works with vendors in the community to schedule your care. We partner with over 40 vendor sites. Some of our largest sites include, or most frequently used sites include Wellstar, Northside, Piedmont, Emory, and then we also have some northern sites that we are grateful for to provide care for those women that are receiving care in Oakwood, in Blairsville. And so our footprint expands across the Atlanta area and beyond. So you will be able to get your mammography care with collaboration with your primary care provider who submits that consult. For the future, we are planning to have on-site mammography. And we are working really hard as an interprofessional, interdisciplinary team to bring that offering to you all. Our plan is to bring that offering to you starting in the fall. We have a few things that we just need to get into place to be able to do that. And so we're really excited about it, and we will have an opening, and it's really going to be a big deal. I do have an ask of you as the patient as we prepare to transition some of the mammography care from the community to on-site. The care coordination piece requires that we all have an awareness of what's needed in order to know what happened to your breast health care in the past. And so when you have a mammogram, a screening mammogram, or a diagnostic mammogram in the community, ask for the report and the disc from the vendor. Because when you do that, first of all, they're required to give it to you by law. The FDA says you must supply this to the patient. And so at no cost. When you do that, you'll have that in hand. And if you should decide moving forward to get your screening mammogram at the Atlanta VA, we would like to have that disc and that report to upload into our system so that our radiologists can compare the prior to the current. And so that is the only ask that we have right now. Everything else we're working hard and doing to get the on-site mammo care going. We have a wonderful cadre of RNs and NPs that help to coordinate the care across all of those 40 sites of care that I mentioned, those vendors. And so here are our breast navigators and coordinators. Their information is here. They are accessible by VA cell phone, and they can help navigate the care for you. And that is pretty much it. Thank you.
Thank you, Dr. Pittman. Okay, and we have one final speaker before we open up for questions and answers, and this is Allison Cooper, and she is from Community Care here at the VA.
Hello, I'll be quick because I know there's probably a gang of questions in the comments. I was going to say we'll end the, save the best for last, but Dr. Pittman really gave us some great information. So I'm here. So I'm here to represent community care and just a couple of housekeeping things as far as when you're dealing with community care. We ask that, it's very important that you discuss your care needs with your provider prior to us contacting you to schedule that appointment. Sometimes we find out you may not know exactly why you're being referred to the community, and our staff, they can answer basic questions about the consult, but anything more complex would need input from the provider. And we just don't want to delay that care going back and forth with exactly why this consult was placed. We ask that you ensure your phone number is correct in CPRS. The telephone is pretty much our go-to method to initiate that contact and that scheduling. You may find that when we call you, it may show up as spam or an unknown number. A lot of times, when I call a patient, I'll leave a voicemail identifying myself, give the patient or give you guys a minute to kind of check that voicemail, and then I'll call right back a minute later, just so you know that number was somebody from VA calling. So we just ask that you keep that number current. And after we make that call, we'll send you a letter letting you know that we did try to give you guys a call. That letter's going to have the reason why we call, the referral that you're being, the consult of why you're being referred to the community. It'll have our contact number and the scheduler's direct extension, so you can call that person back that's actually going to do the scheduling for you. If you call us back and you don't get us, I don't believe we have voicemail set up, so My Healthy Vet is probably the best way to get to us. Just let us know in the subject line, GYN or whatever the consult is for, missed call. At that time, we're able to direct that secure message directly to the scheduler, and even then, we can start brokering an appointment, getting your preferences via My Healthy Vet. We're really pushing our staff to kind of communicate with the veterans via My Healthy Vet.
Could you repeat that again? I was so excited to hear that, and I want to make sure everybody heard that and that they know exactly how to get the attention.
We're really pushing the staff to communicate with veterans via My Healthy Vet.
Yeah, and
Okay?
what they put in the topic.
Oh,
So
no, yeah,
how to get
the
it-
subject,
Yeah.
whatever the consult may be, whether it's breast care, GYN, just because we have a team, for, for women's health. And, we'll just direct it to that individual. It's just quicker. Whoever's doing screen messages that day, it's just easier to direct that message. Please, we ask that you attend the appointment. We know we experience a lot of scheduling delays, so the appointment that we did book for you, please try your best to attend it. If you cannot, go ahead and reschedule yourself. As long as that rescheduled appointment is within the validity period, you should be okay. But if you have any concerns, please call us, Contact Center, or My Healthy Vet. Let me see. And after the appointment time, you'll likely get a text message asking whether or not you attended that appointment. We ask that you go ahead and respond to that, because that'll let us know whether we need to go ahead and contact the vendor to request records for you or reschedule another appointment for you, with your help. And I think lastly, if you just have any questions, again, secure message to ask community care a question. That's really, I think, the best way to get through community care at this point in the game. We have someone monitoring those secure messages and directing them to the right staff at this time. So that's it for me.
Excellent, thank you. And I love when I learn something new. I think I know a lot of stuff, but when I come here, I always learn so much more. So, excuse me, there are some times for questions now, and I think that there are some issues with the chat box, but some of the questions that I've already received have to do so far with maternity care. So, Zakiya, if you could come up here. A veteran wants to know if she did not participate in the prenatal care, so if she didn't get her maternity care through the VA, but she now has an infant, because she's a new veteran that's moved here, can she still participate in your postpartum services?
Yes, you may. That is the answer. Yes, you can feel free to reach out to me or reach out to Ms. Crawford. I believe our contact information is in the chat, and we will reach out to you and set up an appointment so we can kind of review what your needs may be and see how we can help.
Because similarly, but not this exact situation the veteran mentioned, we had a veteran who used a surrogate for her pregnancy. So she wasn't engaged with her prenatal care with us, but she was engaged in the postpartum part of the program. So yes, as long as you either have a pregnancy or a baby under 1, we want you.
And we do know that a lot of our veterans move around, so we want to make sure that they don't miss out just because they might have used the maternity prenatal care somewhere else. When they settle to us, we definitely want to make sure that they benefit from that. And also, if somebody has adopted a baby,
Yes.
There are some great resources.
Yes, so that's interesting.
So for the prenatal care, when you are registering for prenatal care with our maternity care coordinators, part of the offering is if you're going to breastfeed, the VA supplies a breast pump for you in nursing bras and lots of other prenatal vitamins and different things. And so we want to make sure that our veterans have that and that we can support those efforts. So any questions that you have, please reach out to our maternity team, and we're happy to address that.
Thank you.
Okay, another question is for Kamari. So if I show up at a PACT Act community event, what can I expect?
That is a great question. It also will depend on what the event looks like. Sometimes we have some events where it's more so speaking and information sharing. But if it is a PACT Act rally or a PACT Act claims filing event, you can expect to receive information about the PACT Act, toxic exposure screening on site if you have not received one already, claims information and claims filing on site, as well as VA programming will be there to share information about the various programs that we offer here at the hospital. So that's kind of what you can expect from a PACT Act event.
Thank you. And a question for Jana Payan about reproductive health. Can you tell me again what birth control options are available?
Every little thing. So from condoms, We did have spermicide, but those are on back order right now. There is birth control patches. There are birth control pills, all different kinds of birth control pills, progestin-only pills, combined birth control pills. There is Depo-Provera, both the kind that you go into the clinic to get a shot, and those that you can do a subcutaneous injection at home if you're somebody that's comfortable with doing that and moving around and you don't have the time to come into the clinic every 90 days. So those are the things that are offered. NuvaRing, thank you. I knew I was missing one. Okay, NuvaRing, which is also a form of combined hormonal contraception, but it's not a pill. It's something that you put in the vagina, like you would like a diaphragm, and leave it in for 28 days, and then take it out and have a period. Now, as far as things that you would need a referral for to GYN specialty would be IUDs. We have 3-year IUDs, 5-year IUDs, 8-year IUDs, and 10 to 12-year IUDs. So we have the full gamut. We have Nexplanon, which is the implanted rod that goes up under just the skin surface under the arm. That's good for up to 5 years. And of course, any of these, that's the longest effective efficacy for those, but they can also be removed at any time. So just because you opt for an 8-year progesterone IUD does not mean that in 2 years you can't have it removed to build your family. And there is also tubal ligation. We also offer tubal ligation reversal on the infertility side of that as well. Of course, tubal ligation is meant to be a permanent form of contraception, so we do want to make sure our women veterans know that that is meant to be permanent. It's not always a guarantee that it can be reversed. Did I miss anything else? Right, not everyone is a candidate for tubal reversal. That is correct. But I did want to just say that that is an option, but it is meant to be a permanent form of sterilization. Okay, handing back.
Thank you so much. Another question was, are there women's only groups? And I can answer that. So we do have multiple women's only group. There's a women's only spirituality group, depression group, the veteran Empower Veteran program that has pain relief without opiates. They have a women's only cohort as well. As Zakia mentioned earlier, there's a mindfulness for our maternity program group for women that are in the maternity program, and there's a Rose group, which is for pregnant moms, and the whole idea is to really address the tendency for postpartum depression and to prevent it. So it's a preventative group to offer support and education. And what we ask our women veterans to do is, please, if you have a desire to have a female-only group, ask for it. So maybe historically you asked and it didn't happen, but our numbers are increasing. We have so many women veterans, and so when there's demand, that's when we create the supply. So please let us know. That Women Veteran Call Center number will be placed in the chat periodically, and that is great because you can text that. That number is open on Saturdays. A lot of times women veterans will say that they have difficulty reaching folks because they're working and they're taking care of kids in the evenings on weekdays. So having access to somebody on a Saturday is really helpful. And so the call center also will route anything to myself or different members of our team if they're not able to address it with you. So that's another piece. And let's see how we're doing on time. We're doing good. We still have some time for some more questions. I know that there was one question about breast health and when the breast health oncologist will be available. And I'll give that to Dr. Pittman.
Okay, yes, so we did have a breast oncologist. She was great, but her husband relocated somewhere and she had to follow her family. And so we no longer have her on our staff, but we have wonderful oncologists that do take care of breast cancer, and they're well versed in that. In addition to that, we have a tele-oncology group that is provided, I think it's from one of the VISNs. I can't remember exactly which VISN it's provided from, but it's accessible to all VAs across the country. And we consult them in an interfacility type of consult manner. And they have an interprofessional team that includes breast oncologists and mammographers, radiologists, nurse practitioners. And when we consult them, they look at the case holistically and can provide somewhat like of a second opinion. And so we can definitely connect you with that through consultation. The navigators know how to place the consult, and also your primary care provider knows how to place the consult, but if they don't, they know how to reach the navigator who will help navigate that situation. Thank you.
Thank you, Dr. Pittman. And another question is about whole health. What can you tell us about whole health for women? So we do have a great whole health program at the Atlanta VA. There is now a woman veteran who is also a peer, and she works in the whole health program, and she does a women's only introduction to whole health. So if you are interested, ask one of your providers to place a consult into a consult for whole health, and they will connect you into that group. There are so many different offerings, and everything from Tai Chi and yoga, and food is medicine, nutrition, virtual gardening, stress reduction, mindfulness, writing for healing. I mean, there's more. I know I'm not mentioning them all. So some of them are women's only, some of them are co-ed, but it is really important to know what's being offered. And even if you did one of those in the past, at this stage in your health journey, you would be eligible to do a lot of them again. So please do look at whole health. It's a great holistic way of improving your health and increasing your support. Okay, those were all the questions I had. I just don't know if anybody in our audience has any questions for any of the stakeholders or folks that are here. No. Well, one thing I would like to say is we work close with CDCE, and that they used to be voluntary services, and they're the community development folks. So we do outreach activities. The women's program will come and have tables and try to do information giveaways for folks. We also, we work with, when new veterans come and sign up at the VA, we send a welcome packet. We want them to have information about all of our services as well. So we work with eligibility to create packets for folks and give them. Now, some people have been here for a while. If you find that you have questions about what's offered, you can let us know and we can send you out a welcome packet. Even though you've been here for a while, sometimes it's important to get a refresher. And maybe when you initially learned about programming, some of them are new because we continue to grow and develop. We add staff, we add programs. So we want to make sure that we're adding additional information to your knowledge base as well. And my final plug for secure messaging, as you know now, even with community care, you can communicate with them. You can hit all the programs here. And we really want for people to have that advocacy and that connection with their providers. I know, well, one thing I forgot to mention is somebody asked about the Veteran Experience Office. And we do have the Veteran Experience Chief who is monitoring the chat and will answer any questions for the Veteran Experience staff. And she will get back to you regarding your questions if it's something that you need to talk to them about, the Patient Advocate's Office. Okay, so any final questions, concerns, or anything before we sign off on our town hall? I want to thank everybody for coming and for participating. We look forward to this. Oh, one other thing. I know I keep telling you I'm done, but I keep remembering things. We do focus groups quarterly, and those focus groups are really helpful to be able to impact the care and the direction of our care. And when we ask for funding from national, it helps us develop which direction to go in. So if you have an interest to participate in a focus group, please reach out to me, and my contact information is in those slides. We do them quarterly, and we have had a really great response. Zakia has done a tremendous job in being able to meet with these veterans and get their input and their information, and we use that feedback. We send it to our executive leadership. We're able to look at what we can do better and how we can learn and grow. And not only does it benefit you about your particular issue, but it benefits all the other women veterans that may have some similar needs and maybe didn't feel comfortable advocating or didn't have an opportunity to share their voice. And that's also why we do these town halls, is to have a safe environment. Our women veterans let us know they weren't always comfortable attending the main town hall because they felt like the minority and didn't always feel comfortable, and enjoyed coming to these town halls because they were more gender specific, more focused on maybe their issues, and they felt that it was a positive environment for them to be able to get information, learn more about their providers, and talk about their care. So I'm really done this time. So thank you all for participating. I appreciate it, and have a good evening.